We start in Nigeria, where at least 1.4 million people are at risk of contracting cholera. The disease is sweeping through camps for people displaced by the Boko Haram insurgency in the northeast of the country. UNICEF has reported an estimated 28 people have already died. More than 800 cases have been reported, many of them children under the age of 5. The outbreak was first identified in the Munagaraj camp in Maiduguri, the capital of Borno state. Aid agencies have warned their facilities are overstretched, which could lead to the rapid spread of the disease. Cholera kills rapidly, but with early diagnosis and proper treatment, the chances of survival are greatly improved. Well, now for more info on that outbreak, we're now joined live by our correspondent Deji Badmus in Lagos. Deji, just how bad is the situation in the camps right now?
Well, Mahia, it's quite bad. When you consider the fatality rate of this outbreak, it's put at around over 4%, 4.3% to be precise. Now, that is far and above the 1% prescribed by the World Health Organization for an outbreak to be declared an emergency. So this is more than an emergency. So far, 28 persons have died and well, suspected cases 837. So it's really bad, and it's spreading quite fast, even though the authorities are doing everything to contain it. But the situation, of course, is not helped by the sanitary conditions in some of these camps, especially the camp at Munagaraj that is overcrowded, and access to potable drinking water too is a problem in some of these camps like Munagaraj. So it's a terrible situation, and the reason why this is even more terrible is that of the 837 suspected cases that authorities say they have now, about 145 of them are children, under the age of 5. And you know what happens. It's always difficult for children to withstand this disease, and the way it kills very fast if it is not identified early enough and treated early enough. Mahia?
Deji, what exactly do we know at the moment about how the government is responding to this threat?
Well, what the government is doing, the government has actually been responding for quite a while now. The National Center for Disease Control has moved in what it calls its rapid response team to Maiduguri and to the various camps. As a matter of fact, in Munagaraj, the NCDC has actually set up a management and treatment center there. And what they're doing now, as we're told, is that they're trying to identify suspected cases, do contact tracing so as to prevent the spread of the disease. And then they have, as I said, a case management center there. And they're working in concert with the Borno State Ministry of Health, as well as the World Health Organization. MSF, that's Médecins Sans Frontières, is also on the ground. As a matter of fact, Médecins Sans Frontières has set up a 50-bed cholera hospital in one of the camps. And so they are doing everything to manage the situation. And they are trying to enlighten the people on, observing personal hygiene. They are trying to improve access now to quality and safe drinking water in some of the camps. And of course, the case management, which is very important. Unfortunately, these 28 persons that have been confirmed dead now, we do not know. The number might be higher, but these are the cases that the officials actually have, and that's why the government is doing everything to stop it. But the Borno State government has actually assured that it's on top of the situation, and that in no time at all it will check the spread of this disease. Of course, the rainy season is not helping, because this is the peak of the rainy season in that area. And the Munagaraj camp too, I should add, is partly flooded. So that is part of what is actually driving the spread of this disease. But the government says it's on top of the situation and we'll check it. Mahia?
All right, Deji, thank you for bringing us up to speed on that unfolding situation. CGTN's Deji Badmus speaking to us from Lagos there.